Hi, this is Amin Ebrahimi, physical therapist, and today we're going to talk about physical therapy interventions in headaches. For many people, headaches are debilitating, taking over their day and often quality of their life. Pain of any type that occurs in any part of the head is called headache. Often, they go away on their own, perhaps with the help of an over-the-counter medicine. Yet, taking pain medication isn't ideal, and it doesn't always work either. The challenge lies in determining the type of the headache, and there is effective treatment for almost every type of it. The International Headache Society describes several different categories of headache, but the three most common types are migraine, tension type, and cervicogenic headaches. Diagnosing a headache is an important step towards finding an appropriate treatment. The bolder variety may have a cause bigger than acetaminophen can solve. They may have a source that's more problematic. These types of headaches may linger. Physical therapy has shown to be effective in both migraine and tension type headaches, but is the most effective treatment in cervicogenic headaches. Cervicogenic headache, also called muscle spasm headache, presents as a pain that originates in the neck. Cervicogenic headaches can mimic migraines, so it may be difficult to distinguish a cervicogenic headache from a migraine. The primary difference is that a migraine headache is rooted in the brain and a cervicogenic headache is rooted in the cervical spine or base of the skull region. Cervicogenic headaches can also cause symptoms similar to migraine headaches, such as light sensitivity, noise sensitivity, blurry vision, and an upset stomach. People with cervicogenic headaches often have a reduced range of motion of their neck and worsening of their headache with certain movements or pressure applied to certain spots of their neck. The headaches are often side-blocked, meaning they occur only on one side of their neck, head, or face, and the pain may radiate from the neck or back of the head up to the front of the head or behind the eye. The headache may or may not be associated with the neck pain. Cervicogenic headache is a common cause of chronic headache, which is often misdiagnosed. Cervicogenic headache is a secondary headache, which means that it is caused by another illness or physical issue. In the case of cervicogenic headache, the cause is a disorder of the cervical spine and its component bone, disc, and soft tissue elements. Numerous pain-sensitive components exist in the cervical and occipital regions. A common cause for CGH is whiplash injury, resulting in pain shortly after the injury. CGH originating from whiplash may resolve in a few days or may last for years. In some cases, CGH may be caused by dangerous underlying conditions such as a tumor, hemorrhage, fracture, or arteriovenous malformation in the head or neck regions. In such cases, one or more of the following symptoms may also be present. A change in the type of headache, such as severe headache that is intolerable, nausea and vomiting, confusion and disorientation, headaches triggered by coughing or Valsalva maneuver, neck stiffness and swelling, and numbness in the arm. Besides, a problem in the neck, head, or jaw, such as an injury or arthritis, can lead to tension in the muscles at the back of the head and to increased pressure on the nerves to the face and head. Poor posture can cause these muscles to become overworked, which can trigger a headache. People often describe a tightness, a sensation of someone tugging on their hair, or a feeling of wearing a tight cap. These headaches can worsen with specific positions, such as sitting at a desk, and may ease with rest. Factors that contribute to cervicogenic headaches include stiff neck joints, nerve irritation, and muscle tightness. Your physical therapist will conduct a thorough examination. They will ask you questions and perform tests to determine the most likely cause of your headaches. A physical therapist can devise a set of protocols that will help in the following: decreasing pain and inflammation, strengthening the muscles of the neck and upper body, reducing stiffness, improving range of movement and function, and eliminating or reducing the amount of medication you use. The ultimate goal of physical therapy for cervicogenic headaches is to reduce the severity and frequency of this type of headache. Protocols we employ include muscle stretching and strengthening exercises, manual therapy like massage, soft tissue mobilization and myofascial release, dry needling, transcutaneous electrical nerve stimulation, ultrasound, laser, magnet and RF therapy, and postural training. If your pain from CGH is severe, your doctor may suggest an operation to keep your nerves from being squeezed, but this is rare. There is some evidence that cervical epidural steroid injection has some benefits in treating pain in a cervicogenic headache. Steroids can work in this setting due to the theory that the pain continues sensitizing the cervical nerve roots and initiates a pain-producing loop involving nerve root and microvascular inflammation as well as a mechanically induced microinjury. Some occurrences of cervicogenic headaches are not preventable. This is the case with headaches stemming from a condition like osteoarthritis, which tends to set in with age. Some of the same strategies for managing pain may also prevent these headaches. For example, practice good posture when you're sitting or driving. Don't sleep with your head propped too high on a pillow. Instead, keep your neck and spine in alignment, and use a neck brace if you're sleeping in a chair or sitting upright. Also, avoid head and neck collisions when playing sports to prevent injury to cervical spine. And now I'll show you some exercises to prevent headache. This is the end of this video. I hope you liked it. Please share your experiences about headaches in the comments. We'll be glad to read them.